Okay, so good morning, everyone. Kelly, would you raise your hand if you can hear me? Okay, great, thanks. Um, I'm very excited to present this information this morning, and this is information for how you, as a health professional, can create health for your patients and for your practice, but also how you can, by creating a second income stream that has the potential of becoming a plan B, how you can create health for yourself. And I'll explain what that means as I go along in the presentation. So, my name is Dr. Delia Garcia. I am actually a retired radiation oncologist. I practiced medicine here in St. Louis for 27 years, trained at Washington University in St. Louis. And then after I finished my training, I stayed on the faculty for 7 years. Eventually, I went on to become a founding partner of a freestanding breast center. So my partners in crime were two women breast surgeons, two women medical oncologists, and then I did the radiation. And we eventually expanded to 10 physicians. One of the major hospital systems in St. Louis bought our practice in 2009, and I ended up leaving medicine in 2011. Today, I've reinvented myself as a health coach, and my rank within our organization is that of global director. So if you kind of keep in mind that global director, it doesn't mean anything to you right this minute, but you'll see as I develop the talk and I show you some of the potential income, what that means. So I'm very, very proud of the fact that I am a certified health coach. And not so long ago, if someone would ask me what I did, I would say I was a radiation oncologist, even though I haven't practiced since 2011. But today, when people ask me, I say I'm a certified health coach. I help people get to a healthy weight, reduce and eliminate medications, and reverse medical conditions such as diabetes and hypertension. So I'm very, very proud of that. And our company that I'm going to feature has a wonderful certification process through Villanova University School of Nursing. And this is a certificate that I have framed and hung with my medical degree and my board certification. So I'm very proud of it. So if we look at where we are as health professionals, when we're working with our patients, and even when we consider our own lives, we can follow a path of sickness or a path of health. And most Americans are following the slippery slope towards sickness. And a lot of the problems that we see in medicine are as a result of overweight and eventually obesity because of our diet and our lifestyle. And I don't know about you, but I just got so tired of seeing beautiful people that I was seeing in my practice on this slippery slope. And it began to affect me in so many ways. And I realized that I was on that slope myself for a number of reasons. Not sleeping very well, being anxious, experiencing stress, and so on and so forth. So now I help people get on the other path of that health path. So as health professionals, again, most of us are trapped on the path of treating, managing, and reacting to disease. We're certainly helping cure cancer, like I was. We're helping people manage their symptoms of heart disease, symptoms of autoimmune disease, but much of what we do is a Band-Aid approach. And consider this other path, that of truly helping someone create optimal health, not only for your patients, for your practice, but also for yourself and your family. Because as health professionals, many times we are suffering along with our patients, and our families are suffering, our children are suffering. So I love being on the other side of the fence now, no longer reacting to disease, but truly helping people create optimal health in their lives. So what are you looking for? Are you looking for health for your patients, health for your practice, health for yourself? Maybe you're looking for a less stressful life. You're looking for better sleep. You might be looking for more time for yourself and the people that are most important to you. Perhaps you're looking for more control over the time in your day, the freedom to organize your life around what matters most. But again, as healthy or as busy health professionals, much of this often evades us. So what I was looking for when I was introduced to Take Shape for Life was I was looking for a way to help my patients. As I mentioned, my background is that of radiation oncology, and early on in my career, I saw patients with all types of cancer. But as time went on, I really subspecialized in breast cancer. So I had these beautiful women that would come to see me each and every day, and they kept getting younger and younger. So they were, eventually they were coming in when they were in their 40s and 30s and 20s. One day I had a 17-year-old who came in with her mom and dad to discuss her breast cancer treatment options. I was shocked, but it's really no different than what we're seeing today. 5- and 6-year-old children with type 2 diabetes that used to be called adult onset diabetes because it wasn't a disease of children or young adults. So our world has really, really changed in the past several decades, where we're seeing diseases that we once saw in grandparents in people who are very young. And so what I became very aware of was the fact that there's a huge link between overweight and obesity and breast cancer. Being overweight is a huge risk factor for breast cancer because of estrogen dominance. So women with excess weight have higher circulating estrogen levels, and that is the precursor for breast cancer. So I started to offer diet and lifestyle to my patients, but I didn't have anything that really worked other than the usual advice of, eat less and exercise more. That obviously was not working very well. So I was looking for a mechanism to really make a difference in the lives of these young women because so much was at stake. You can see in the picture in the upper left-hand corner, one of my patients who has given me permission to use her picture. And, if she doesn't do well, who's going to raise those children? Sure, there's a dad in the picture somewhere, but dads can be overwhelmed. They're going to work every day, trying to put food on the table for the family. And, the children are oftentimes raising themselves. So lots at stake with these very young patients. And so we know that increasingly we're seeing an erosion of health, not only among our patient population, but with ourselves as well. Increasing weight, people that struggle with sleep, they're not very active, their lives are completely out of balance, they're stressed, they don't have enough time for family and friends, they certainly don't have much in the way of financial security. So lots of issues that we see in our country. And for myself, before I became involved in Take Shape for Life, this wonderful program and business model that I will expand on as we go along, I was working 60 to 80 hours a week. So I wasn't spending a lot of time with my own children. I was tired a lot. I remember coming home from work and I just was so tired I could barely, concentrate on anything else. Exhausted many times. And once we sold our practice to the hospital system, the environment became unhealthy. We now had layers of administrators telling us what to do when we knew what to do. We had built this amazing practice, and suddenly we had lost our autonomy. So stress, I wasn't sleeping very well. I had chronic insomnia, not a lot of time for myself or my family. I was just surviving. I certainly wasn't thriving. And if I was honest, my life had become an appendage to my job. And I started to really think, is this the best I can do for my patients? Is this the best I can do for myself? And I think a lot of health professionals struggle with those questions. So I was introduced to Take Shape for Life in 2009, and it gave me a tool to help my patients get their weight off fast and safely. And I know from some of the published studies out there, this is a study from the Cleveland Clinic, showing that if you take someone who's obese and you get them to a healthy weight, you can oftentimes reverse chronic medical conditions in huge percentages. So this is a slide showing some of that data. Type 2 diabetes, for instance, 83% of the time you can reverse diabetes by getting someone to a healthy weight. Depression, 55% reversal. The 5-year risk of dying of any cause reduced by 89% by getting to a healthy weight. So this got me excited and made me realize that I was certainly in bed with the right company and the right business model. So now my life is completely different since I've left mainstream medicine, and I became a full-time certified health coach with Take Shape for Life. One of the things that I really enjoy is travel, but when I was practicing medicine, I didn't get to travel very much. I was lucky to take a week off here or there. And most of that week I spent thinking about the work I left behind, and then towards the end of the vacation, the work I was going back to. But here I am on these 3 wonderful vacations to the Galapagos Islands off the coast of Ecuador, Machu Picchu in Peru, and then Myanmar in Southeast Asia, where I spent 3 weeks last year. 3 weeks. Can you imagine being gone for 3 weeks? And when I came back, my business was bigger than it was when I left. So I couldn't be more grateful for the life that I have now. And the other thing that's even more important is that I get to spend time in my own home. I love my house. I'm a decorator. I love to dabble in gardening, entertaining, and now I can be home whenever I want because I work from home. So I'm no longer rushing to an office. And I get to spend time with my 3 fabulous children. They're all in their 20s now. And so I feel so blessed. And I want this for anyone that was struggling or is struggling like I was struggling before I crossed over to the other side of the fence, if you will. So optimal health is really working to achieve your best in a lot of different areas, not just in the nutrition side and the physical health side, but with family, having time for friends, having time for yourself, sleeping, being more active, spiritual time, having financial security. But so optimal health really covers a lot of different gamuts. And I'd like to feature Dr. Kathy Botany. Kathy, you'll have to unmute yourself. Kathy is a fabulous health coach. Go ahead, Kathy, and share your story.
Okay. Well, welcome everybody, and thank you for taking time out of your schedules today. My personal weight loss story began in 2009 when I had gradually let my weight creep up. The menopausal creep. It's a terrible thing. And I had several patients who I shared with a wonderful internist, Dr. Brenda Eisen, and I found out what they were doing and met with Brenda, got myself on the program, lost 35 pounds in 3 and a little bit months, and then started offering the program to my patients. And over the last 5 years, my patients have lost over 10,000 pounds. And it has been the most rewarding thing that I think I've ever done. I mean, I'm in medicine because my mom passed away from ovarian cancer, and it's definitely a calling for me, not just a job. But I still love that piece of myself. I love being a physician, but I have been so happy to weave this into my practice. And so the joy that I get from helping my patients is just incredible. And then I've also been very blessed to have great mentorship and helping me reach out and bring this opportunity to other physicians and health professionals, physical therapists and nurses. So my team has grown. My family members are involved in this. My Y, that's a picture of my son's wedding, and he is a full-time health coach. My daughter-in-law, the blonde, is also a health coach, a professional ballroom dancer. So our family has benefited from this immensely. In terms of my team, what I love is that from the physician standpoint, I have lovely people that I really enjoy working with. I don't invite people into the business that I don't really enjoy as human beings. And people do it all different ways. I know that Beth Wadsworth is on the call today. Her husband, Harry, was my very first coach. He's an endocrinologist. And, he's been able to share the program with his patients. And Beth runs the business. I mean, it's really Beth's business, but Dr. Wadsworth is definitely the conduit to the beginning of their path as well. And the program just brings me such joy and has been a financial blessing. The way it's set up, not only do I get a very large amount of income from the coaching of my patients, but also from building my team. And this last year, I've had 3 different shoulder surgeries. And again, as Dee said, my business grew bigger in the time that I was actually off work because I was able to, have this trudge on no matter what. And the coaching, I've done coaching in different ways. I've had my nurse coach my patients, and I would just touch base occasionally. I've had one of my patients became a health coach, and she helped me coach my patients because I didn't think I would have the time to do it. But what I did find is that I can do this part-time, and yet I can get a full-time income. So I now coach my own clients, and I love doing that. But it's a 5-minute phone call once a week and has worked beautifully for me and allowed me to really get to know people in a different way. So this opportunity has just been outstanding for me, and I thank Dee and Dr. Eisen for bringing it into my world.
Thank you, Kathy. Beautifully said. So who is Take Shape for Life? We are a community of independent health coaches. About 25% of our health coaches are health professionals. 75% are people from all walks of life. So you don't have to be a health professional to do a great job of helping people get healthy. I love that we're physician-led. The head of our group is Dr. Wayne Scott Anderson. He was a critical care physician who left medicine about 13 years ago to work on this fabulous program and business model. So we as health coaches are focused on helping people create health in their lives rather than reacting to disease. And why we're so successful with this particular program and business model, we are reshaping the industry with an integrity-driven seasoned partner. We've got a comprehensive program that offers optimal health to each and every person. We have a unique and powerful business model. We have a fabulous compensation opportunity, and we really are the solution to our country's healthcare crisis. So I'm going to show you each of these points very quickly. So we're changing our industry from that of diet and weight loss to optimal health. And there really is a shift there that's very important. It's a different mindset. Dieting is all about deprivation. Optimal health is all about hope and creating this vibrant health and longevity that people are not experiencing nowadays because of their health issues. And we have a tremendous opportunity with Take Shape for Life because currently the diet industry and weight loss industry is a $68 billion a year industry, and it's growing at 7% per year. Take Shape for Life is less than 1% of that $68 billion. So we have a great opportunity to grow that. Our partner is Medifast, our parent company. It's a publicly traded company on the New York Stock Exchange. We have been recognized by Fortune magazine and Forbes magazine as one of the best small companies and fastest growing small companies in the U.S. We've been a leader in manufacturing effective and safe meal replacements for over 35 years. Our products and programs have been recommended by thousands of physicians since 1980. We also have proven safe and effective clinical studies using our 5-in-1 plan. So our 5-in-1 plan is 5 meal replacements a day and 1 meal of our own, one meal that our clients and patients do on their own. The meal is described as a lean and green, lean protein and vegetables or a salad. So it gives people flexibility. They can eat that meal at a restaurant. They can fix it at home for their whole family. The rest of the time, the program is super easy. They're tapping into one of the meal replacements. And also, there has been a tremendous amount of research from Johns Hopkins University on our program. So our program is comprehensive. It's turnkey, super simple for both our clients and healthcare providers. On the program, people lose weight fast and safely, up to 2 to 5 pounds a week the first 2 weeks, and then they usually settle into 1 to 2 pounds a week after the first 2 weeks. Along with losing the weight, there are tools and support systems in place to add layers of support besides the health coaching that Kathy described. And as the scale is moving, you have teachable moments. So now we're introducing our patients and clients to all habits of health, sleep, stress reduction, water, exercise, and so on and so forth. And they learn all of that through our Habits of Health system a book and a workbook that have been written by Dr. Anderson, our founder. So wonderful information. And really, the MetaFast meals are a tool that helps this whole program be effective. But the Habits of Health system is really our program. The program is very inexpensive. It's $12 a day. So it's not costing a patient any more than they're already spending on food. And for many people, it's saving them money. So for $12 a day, they're getting the 5 meal replacements. The coaching is free. We get paid directly by the company, and I'll show you that as we go on. And they have all of these additional layers of support as well. Our business model, it's all about coaching services. So we are unique. We generate income coaching our clients in pursuit of their health goals. And we also can generate income teaching and mentoring health coaches that we invite into our business. Like Dr. Botany said, she only invites the people that she likes, the people that she feels have the same values that she has, and so forth. Our compensation plan, it's a part-time effort, and for a part-time effort, you can create a full-time income. And I love the fact that income is based on the amount of work that you do. There's no cap on earnings. And so let me show you what is possible with the compensation. There is a wide range of options. And this slide really will show you some possibilities, but I want to clarify, this is an opportunity. It's not a job, so none of these incomes are guaranteed. It all depends on your personal efforts. But if you're just getting started as a brand new health coach with 5 clients, your first 5 clients, first 5 patients on the program, you will generate about $500. If you have more people that you put on the program in that first month, you'll generate more than $500. As you continue to add clients to the program, you achieve that level of what we call executive director. That is the highest commission level of 31%. I'm going to show you those numbers, so hang on. But an executive director is where you're managing about 25 clients that are on the weight loss phase of our program. And that's a monthly income that ranges between $2,000 and $4,000. And then as a national director, Kathy mentioned a little bit about our expansion model. But if you develop 3 executive director teams, executive director, again, you're managing about 25 people on the weight loss phase. That's a monthly income that ranges between $5,000 and $10,000. You develop 5 executive director teams, the income can get pretty hefty, between $10,000 and $25,000 a month. So you're free to build the business that you want. You can help a few patients, or you can help a lot of people. You can bring people into your organization, or you can choose not to. So you are free to create whatever you want. We do have great timing. We have a health crisis in our country. We know that most of the states, especially in the Midwest and in the South, have obesity rates of 30% and greater. So there's no lack of candidates out there. In fact, there are people every night who are on their knees asking God to bring someone into their life that can help them change their health picture. So I always say, I am looking for the people that are looking for me. Not everyone is ready to change their health picture and tackle their weight, but there are certainly lots of people out there. So with our timing, we have more than 2/3 of American adults that are overweight. More than 1/3 who are obese. That means a body mass index of 30 or greater. A fifth of our children are now obese. That just breaks my heart. They're setting themselves up for lots of suffering and illness and premature death. It's as simple as that. We have 29 million Americans who are known diabetics and many million more who are pre-diabetics. Many of them don't even know that they're pre-diabetics. So again, the timing couldn't be better. Also, if we look at healthcare providers, there's a lot of dissatisfaction going on. High frustration, growing bureaucracy, less autonomy, reimbursements are going down, overheads going up. The new ICD-9 or ICD-10 codes are coming into being, and there are something like 64,000 codes. It's mind-boggling. More regulation in healthcare, longer hours. The electronic medical record has added a whole layer of stress to a lot of, especially older physicians, where physicians are no longer looking their patient in the eye, but they're staring at their computer screen as they're asking questions. The younger physicians have a lot of debt. My son just graduated from medical school. He's in his first year of residency, and he was embarrassed to get into a conversation of debt because he has no debt, but his classmates were carrying $100,000, $200,000 of debt coming out of medical school. And burnout for physicians and healthcare professionals who are in their middle years and older is rampant. So the timing for offering health professionals another income stream, a way to help their patients is really prime. So as a Take Shape for Life independent health coach, you can create options for your patients, your practice, and yourself. You can set your own hours. You can work part-time or full-time. It's $199 to become a health coach, and the operating costs are extremely low. You certainly don't have to add any services to an existing medical practice. Now that I am full-time with Take Shape for Life, I work out of my home office. I'm sitting in it right now as we speak. We provide complete training and support, and there are no territories.
Okay, so yep, like Dee said, I'm a nurse practitioner in Omaha, and 3 years ago was practicing internal medicine. A year later, I was invited to purchase the practice that I was working at. So 2 years ago, I purchased that practice, and only 6 months in, Dee was just talking about burnout. 6 months in, I was burned out. I was tired of working so many hours and not paying myself very much at all. And really also burned out with the fact that I didn't have a way to help the patients. I have a really big Medicare population with an amazing amount of comorbid disease and diabetes, etc. And then I met my health coach, Tina, in Omaha. She introduced me to the program. And of course, I didn't think it was for me. I was too busy already. So I referred her some of my patients, and I saw their amazing results. And so I was hooked. I love it. So now, 18 months later, there are some months where my income from this program is more than I pay myself at the clinic, actually, for probably, 10% of the hours or something. So I love it. My patients love it. My friend Patrick there, he is 113 pounds down since last July, and his mom is on the program too. So he let me share his photo. And now I'm helping other nurse practitioners and nurses do what I do. And the last thing I would say is that when I started practicing as a nurse practitioner, I was really tired of just writing prescriptions for everybody. And this changed the whole concept into really what I feel like healthcare is meant to be. Now I'm taking people off of their medications. I'm really caring for them. And it really brought the nurse back out of me, which is my favorite part of the whole thing.
Kelly mentioned this whiteboard that you have in your waiting room.
Yeah, so I put up this whiteboard, and every week or two, I add up my calls when I do the client calls. They'll tell me how much weight they lost, so I update it. And this week, we reached over 1,000 pounds. And so I have a couple patients who have run our food pantry actually in Bellevue, and so they accepted a donation. We donated 1,000 bottles of water in celebration to our local food pantry for that. So,
oh, that's fabulous. And you're now getting to spend more time with your beautiful family. So,
aren't they cute?
Oh,
Yes, I love seeing them.
Yeah, they're adorable. So as a health coach, this new path, and again, I am not suggesting that everyone go out and quit their jobs as a health professional, because Dr. Botany mentioned she loves her job as an OBGYN, and we need health professionals to care for people. But if for those who are adding health coaching to their current positions, or who become full-time health coaches, it's a new path. There's no beeper, there's no night call, no emergencies. You're not selling. You're looking for the people that are looking for you. There's no inventory. The financial transaction on our meal replacements is between the patient and the parent company. You're working for yourself. You are the CEO of your own business. There's no managed care, no ICD codes, and you're really not practicing medicine. You're guiding your patients and clients to health. So the business of creating health in our business model is all about working with clients to help them with their health goals. So that's what we do as a health coach. We acquire and support clients. And if we look at what kinds of income are possible with a Take Shape for Life business that's focused on clients, you can generate somewhere between $3,000 and $5,000 a month very easily and very comfortably. And I'm going to show you some additional data on that. So as a health coach, our role is to partner with our patients and our clients. We're partnering with them. We're walking alongside them and helping them be successful. And in that partnership, we are helping people literally transform their health. Dick is a dairy farmer from Lincoln, Nebraska. He lost 100 pounds. Now he's running marathons. Linda is from Des Moines, Iowa. She lost 80-some pounds with our Take Shape for Life program. And now she's wearing skinny jeans and increasing, and she's increased her activity, and she is loving her new life. She's kept her weight off for a number of years now. And literally, we are helping people get their lives back. So we have people of all ages, men and women. I even have some teenagers that I've helped lose a lot of weight and really transform. There's nothing more exciting than helping a teenager go into their next year of high school feeling like $1 million because their confidence level is through the roof after losing 30, 50, 100 pounds. Lori here on the left lost 128 pounds, and she looks fabulous. Aliki lost 65. And along with the coaching, we have a whole bio network of support. So we have additional layers of support through our business model. So we have the meal plan that I already mentioned. We have the Habits of Health system, the book and the workbook. We also have a virtual clinic, support calls on Monday nights from a nurse. On Wednesdays, there's a 30-minute support call from a physician. Once patients get to their goal weight, we have a 30-minute support call that helps them maintain their weight. These are calls that are live, but if the patients cannot get on the call live, they can also listen to the playback 24/7, or they can access the calls through a website on their computer. At the home office, we have an army of registered dietitians, so our clients and patients can call the home office and have a one-on-one chat with a registered dietitian if they have certain issues that are unique to them or questions that they want answered. So let's look a little more closely at the kinds of incomes that are possible, because there are so many patients that come into health professional offices every day, every week, and could use our help. So if you're coaching 50 clients or patients per month, the average food order for those meal replacements is about $300. You're generating 31% of that. The company is paying what they call compliance fees to help that person be compliant on their program. So that translates into a gross monthly income of just over $5,000, and which translates into $65,000 extra per year. So that's significant income by helping 50 people per month. And you're not looking for 50 new people every month, because some people will be ordering month after month because they have 50 pounds or 100 pounds or more of weight. Let's look at the income if you had 100 clients. Some of them are those that will be on the active weight loss phase, and some will be those that are ordering product for maintenance or transition. So their average order overall may be $250 a month times 31%. So that would be a gross monthly income of $7,750, which translates into $95,000 a year. One of the primary care physicians here in St. Louis, in the first year that he offered Take Shape for Life to his patients, generated $88,000 with just the patient income. So the business of creating health, again, is all about acquiring and coaching our patients and our clients, but we can also get into more of the expansion model and truly create a plan B with this business model. So what is a plan B? That is where you are inviting people to join your team of health coaches. And it's a very organic process, because as people lose weight, everyone notices. You can't hide the fact that you've lost 50 pounds or 30 pounds or 100 pounds. People will notice. And so as healthcare professionals, we love getting referrals from our successful clients and patients, but we can also invite them to become a health coach and help their own sphere of influence and build their own income stream. So that can create a plan B. With coaching clients, you reach a plateau, you run out of time, you can even kind of run out of people, but as you bring people into your organization, they bring people in who bring people in, so that team building can generate very significant income. So treating disease, if we look at treating disease, it's all about creating these networks. I think of Mercy Hospital here in St. Louis, a huge healthcare system that is really all over the country. They have clinics, they have hospitals, they have other support systems built in. So huge networks that they've built to treat disease, and the amount of money that changes hands is gigantic. So what about building that same type of network with a business like ours, that business of creating optimal health? And that's what I'm talking about when I talk about team building. So as a business coach, when you're inviting people to join your organization and become a health coach themselves, you are rewarded by the company. You're given compensation for duplicating. It's almost like building a franchise. So when you do that, when you get involved in our expansion model, you're actually moving our mission forward by increasing the number of people that are able to help those that are struggling. So you can generate significantly more income as a result of team building. And no one knows that better than Dr. Larry Estevo, who is a chiropractor. Larry, would you unmute yourself?
I am unmuted, Dee.
Okay. Would love you to share, first of all, just very briefly, how you did on the program yourself, and the power of duplication, what you're creating for yourself, Larry.
Well, I was looking for a weight loss program for the clinics that I work with. But I actually started out as a client, Dr. Chris Masolia, who I think is on the call, was my coach. That's who I went to because 3 years ago, I saw this picture on the left and hadn't realized I had gotten that far out of shape. So I went through the program for myself first and dropped 50 pounds within 12 weeks. And for the last 3-4 years, I've had no problem keeping that off. The real nice thing about this business, I think, is there's no need to reinvent the wheel. There's been a lot of health professionals way ahead of me that have figured out the systems and procedures and protocols to be very successful. So a lot of the health professionals that I work with at first glimpse like to figure out how to improve a system for some reason, but I'm telling you, with this, there's no need to do that. There is so much information, so many ways laid out to work this program in a health professional setting. Just a great opportunity with the fact that you have people that you could expose this program to who really need it to be as healthy as possible. And I'd also like to point out, I think I look at this as not a weight loss program, but this is almost a complete wellness program with the phases that people go through. First phase being weight loss, and then transition, and then maintenance. Being able to keep it off and avoid the yo-yoing. But the biggest thing, the most important thing is this is very duplicatable. We really want to stress that you don't want to try to figure out a better way. This Take Shape for Life has figured out exactly the steps and systems that can be put in place to be highly successful as quickly as you want. And this business will pay back as much as you want to put into it. You have complete control over that.
Yeah, thank you so much, Larry. It's so true. The system has all been worked out. It's getting better every year. And all we have to do is plug into the system. We don't have to reinvent it. So let's look at the incomes that are possible if you switch from a client-based business to one that is now focused on bringing people, inviting people into your organization. You are still acquiring and supporting clients. You know, I will always do that. I love it. I love working with individuals and with families, but I also love helping bring moms home to be able to raise their own kids, to lower financial stress for health professionals, give them more time, and so forth. So again, the incomes are shown on this slide. They can be very substantial, anywhere from $33,000 a month up to more than $100,000 a month. And I'm not going to belabor this and go over every single detail. So where are you now in terms of your health, your family, relationships, finances, balance, freedom, fulfillment? And again, we're all in different places. What are you looking for? What matters most to you? Would you like to help people and make a difference? Would you like more options for your patients, your practice, yourself? Is your life on hold because of your job? If you could organize your life around what mattered most to you, would you? And this is a business model that can help in each of those areas. So our world as health coaches is full of choices. And here's some pictures of different health professionals. I'm down here in the middle of lower right-hand corner at a Journey concert with friends. When I was working as many hours as I was, I didn't have time for concerts. I didn't have time for myself. I had time for my practice and some time for my children, and that was about it. Dr. Cheryl Child here, who's in the upper right-hand corner, she retired from her practice a few years ago, bought an RV. She spends a month with her animals down in Florida or in the Carolinas, and other time visiting children in Denver. So she's living a fabulous life. And then Dr. Deb Sesker, who's a chiropractor from Des Moines, is featured here with her family in Cabo in Mexico. Deb never had time to take vacations with her family. She was at home manning the office while her family was vacationing on their own. And now she's able to work part-time and join them. And then Dr. Brenda Eisen retired from her practice as a family medicine physician. And likewise, she now has time to vacation with her family. She would stay home while her husband went skiing with the children and the spouses. So lots of possibilities that we can create because of this business model. So reach out to the person who invited you to this presentation. If you like what you heard, we would love to help each and every one of you, help us create a healthier country and also to create options for yourself.